who are seeing teenagers, they definitely it should be discussed. And patients will typically have those exams, hopefully with the pediatrician one-on-one. And yeah, definitely, it's one of the things that they discuss routinely. So patients are pretty comfortable with it when they do come see me, and if there's any abnormalities, they can say, "Yeah, you notice, I do it every so often in the shower, but now I noticed it was a little different."
Okay, just
So
like breast
I
screening.
have a 13-year-old son, and it's pretty interesting times. Okay, so he has a female pediatrician, and so they have conversations about his body and his penis, and we're real big about not naming it something other than what it is.
Mhm.
Um, but it's difficult as a parent and as a mother. Like, I don't want to see your penis. Like, I don't want to check it. And I hope that she can check it for you. And one time, and he's going to be embarrassed me putting his business out, but this was about 3 years ago. And he was like, I think, there's something wrong. I said, yeah, talk to your dad. He was like, but you're a doctor. I'm like, but I'm not your doctor. So, those are conversations that you do have to have. I mean, I am a female, and I do all the female things, but I talked to my pediatrician. So I'm glad you brought that up. I talked to my pediatrician about how to talk to my son about these things, because they're starting to understand body image and body privacy and 13 and all the hormones. And so now he's at the point where I don't think he wants me to be in his business like that. But and I have a 19-year-old son, so we went through that same thing.
Yeah, I think to your point, it's important to have that dialogue. We colloquially refer to it as the birds and the bees, but there's much more in terms of the conversation of sexual health and your own body, and there are those type of discussions that typically wouldn't happen, but they have to happen at some point. And you just
Yeah.
find a way to facilitate that, and explain why we do these things.